So let's review this one, which is the induction time. No? So if you recall the different properties of an ideal local anesthetic solution, no, it also tackles about the onset, no? The time of onset. And this is the induction time. So it means that it is the time from the deposition of your solution to complete conduction block. So when the time you deposit your solution, you did your injection, up to the time the patient feels numbness. And this is governed or controlled by the following factors. Number one, the concentration of the drug. Number two, the pH of our local anesthetic solution. So let us review the pH. Our LA is acidic in nature, correct? Plain LA is acidic. LA with vasoconstrictor is more acidic because vasoconstrictor is also acidic in nature. Okay. Number three, you have the rate of diffusion. And lastly, we have the anatomical barriers of the nerve. So we discussed also last time the organization of our peripheral nerve from one single nerve fiber to your fasciculus from one big peripheral nerve. And the nerves on the periphery are your mantle fibers, and the nerves that are in the center are your core fibers. Okay, so you have your diffusion of your solution from the mantle fibers first, going to the inside, which is the core fibers. And then the nerve will recover because the action of our LA is reversible. And the diffusion of our solution is from the core fibers, which we will lose numbness first, structures innervated by the core fibers, and lastly by the mantle fibers. And then the function is back again. Okay, so we have different factors that can affect the LA action or any drugs. No, it has something to do with the pKa, the lipid solubility, the protein binding, the non-nervous tissue diffusibility, and the vasodilator activity. So if you're going to look at the action affected, the pKa has something to do with the time of onset, and the lower the pKa, the more rapid the time of onset. The lipid solubility has something to do with the potency, how strong the drug is. So the higher the lipid solubility, the greater the potency of the drug. And how long is it binded to the protein receptor site? Then it has something to do with the duration. The higher the protein binding, the longer the duration. And the non-nervous tissue diffusibility, we said that structures surrounding the nerve where you deposit your solution, such as the fat tissue, you have the muscles, can also get our solution, and this can affect the onset. So if the solution has high diffusibility to this non-nervous tissue, then it will affect the time of onset. It will slow down the time of onset. And lastly, the vasodilator activity of the drug, okay, which we will discuss in a while, and it has something to do with the potency and the duration. So if the blood vessel is vasodilated, then there would be an increased blood flow into the area. There would be more rapid absorption of your solution going to the blood circulation. Less solution will be available for the nerve. That's why you have less potency and shorter duration. Okay, so we discussed the different local anesthetic solution. We have our esters and we have the amide group, right? So esters, the only dental ester that we use is the benzocaine, which is the topical form, and most of our injections for the dental anesthesia are from the amides, and which are the following. Okay, it has its own pKa, and pKa, as what we said, can affect the time of onset. You let me know if I'm fast. We're just reviewing this one. Mepivacaine, lidocaine, and prilocaine have the same pKa. That's why they have the same time of onset, and they are the ones that have the fastest time of onset. But as you have higher pKa, which is the procaine, then this one has the slowest time of onset. Okay, the lipid solubility will show us how strong or how potent the drug is. So our LA comes in percent, and later when we go to the discussion of computation, the percent is converted into milligrams. So if you can see that bupivacaine only needs this much milligrams or percent, so that because it is very potent, no, because of its lipid solubility. So please memorize the percent of our LA solution. So bupivacaine is 0.5%. Our lidocaine is 2%, mepivacaine plain is 3%, and prilocaine plain is 4%. So among this, it shows us that the most potent of the group is the 0.5%. So we only need a few milligrams for this bupivacaine to be clinically effective, because if you increase the concentration, then it becomes more potent, more toxic. Okay, and lastly, we have the protein binding. So we can see here the only LA that is long duration or long acting is bupivacaine, because this one has the highest protein binding capacity. Okay, so our nerve will recover, right? But it follows the reverse order because of the how much concentration is inside the nerve going outside. Okay, so let's go to the movements, now pharmacokinetics of our LA in the body. So take note of this. All LA used in dentistry are vasodilators. All LA used in dentistry are vasodilators. Cocaine is the only LA that has vasoconstrictor effect. But since cocaine is not used in dentistry anymore, so that is not counted, that's why all we use are vasodilators. And the most potent actually is the potent vasodilator is procaine. Okay. And what is this vasodilator effect? So sabi natin, all LA are vasodilators. So let's take for example, we have our blood vessel. Okay. So we have blood vessel in the areas and we cannot see it, diba? So everywhere we have blood vessels. And then we'll place our LA, plain LA. So meaning no vasoconstrictors, purely lidocaine, purely mepivacaine, purely prilocaine. So what happens to the blood vessel? It will vasodilate. So it will enlarge, no? Because that's the reaction of the blood vessel to the drug. It will vasodilate. So if you have vasodilator and you have your solution there, right? So what happens? So this, the effect of it is it will increase blood flow, as what we said, into the area. It will absorb more. You're not injecting CLASA inside the blood vessel, but it will absorb our LA, more LA into the bloodstream. More LA kasi you have greater surface area, so you have your, yeah. So what does it mean? If you have more LA in the bloodstream, there is a higher risk of toxicity, which we don't want because we only want our solution for the nerve only. And since it took an amount of LA, the blood vessels took an amount of LA. So there would be less available LA for the nerves. That's why you will have what? Shorter duration. Clear? And if you need to do your surgery class in the area, and if you cut the surface and the blood vessels are dilated, what do you think is the bleeding? You have more bleeding. Diba? We have no control of this because that is how the blood vessel will react. So increased blood flow into the area, you have greater surface area, so you have more absorption of the LA, higher risk of toxicity, and you have less available drug to the nerve. That's why you have shorter duration of action of your anesthesia. And if you need to do your surgery, you have tendency to bleed more. Okay, which you don't want when you do your surgery. Okay, and then we have another solution. which is our LA with vasoconstrictor. Diba? So if you're going to do your injection using your LA with vasoconstrictor, so what happens to the blood vessel? It will vasoconstrict. So mas liliit pa siya. Normal size, from normal size, unstimulated, and then the blood vessel will constrict, will have smaller diameter. Okay, so you place your LA solution in the area. So what happens? What do you think will happen? Will it absorb more LA or absorb less? Siyempre, there would be absorption of less LA. Ito, more LA into the bloodstream. So what do you think? Risk of toxicity, higher or lower? So you have less risk of toxicity, which is good, diba? Oh, what about the duration of action? So there would be more solution available for the nerve. So you have longer duration of action. And if you're going to do your surgery, since you have constricted blood vessel, less blood flow into the area, so what happens? You have less bleeding. Correct? So class, if you want to do your surgery, then you want to use your solution with vasoconstrictor. And how much vasoconstrictor? You want a more concentrated vasoconstrictor, which we will discuss in a while. Clear? So to summarize this one, so if there would be solution of plain